All right, I have 12 o'clock Mountain Standard Time, 2 p.m. Eastern Standard Time on my watch, so we're going to go ahead and get this started. I want to welcome everyone to the Group 2 Support Surface Why Now Drive Cares webinar. Looks like many of you participated in our pre-webinar poll. I'm going to broadcast those results now. Since we will be discussing Group 2s, we thought we'd start by sharing everybody's feelings on getting that Group 2 support service order. Looks like majority of our crowd here, 46.7%, just about half feel excited. That's great. Hopefully you feel even more excited after this webinar, and those that maybe are feeling apprehensive, overwhelmed, are going to feel less of those feelings as we move forward. So thanks for participating in that first poll. We're going to go ahead and get started. So as far as what is to come today, well, we've got a ton of valuable information and insight planned for you, presented by Drive's team of regional clinical vice presidents. A little bit of housekeeping so we're all on the same page. You may have noticed that your microphones are not turned on and that our presentation using Adobe Connect is being delivered over voice over IP or simply audio and video through your internet connection. However, we'll be looking to get our audience involved early and often, both with interactive polls like the one we just started with, and a chat pod which will be left open throughout the webinar for questions and comments. One more shout out to Dave Purdy. If you're having trouble with Adobe Connect, his information is in the notepad at the bottom of the screen. And now that we've covered all of the housekeeping, I'd like to go ahead and introduce myself. My name is Eddie Faber. I'm the National Sales Trainer here at Drive to Vilbus Healthcare, and I'll be the producer on today's webinar. As many of you know, this industry has a way of kind of grabbing onto you and just not letting go. Well, it grabbed onto me just about 10 years ago, first on the provider side as a sales rep for a local independent DME in the Chicagoland area, then as a sales rep working for Drive. Now my responsibilities are to train and support that sales team here at Drive. Now, we know our audience is feeling very overwhelming with these unfamiliar times, really both personally and professionally. And we want everyone to know that we are here to support you in any way we possibly can. We have been busy working from home and brainstorming ways that we can help our customers not just survive, but grow their businesses coming out of this quarantine. That's why we have organized this series of webinars, which is just chock full of insight, best practices, and resources. Let me shine some additional light on that Drive Cares program. Now, today's webinar is the second in a series we're launching as part of the Drive Cares initiative called Hope Drives Us Forward. The Drive Cares program is committed to putting the latest education, the latest evidence and concepts in your hands so you and your business can thrive today and tomorrow, helping you all to do what you do best, which is maximize outcomes for all your patients. Now, today we're going to be talking about embracing Group 2 support services during what we all hope is the conclusion of this pandemic. I could not be prouder to introduce the two regional clinical vice presidents that will be speaking on this topic today, both of which I've had the pleasure of working with as a sales rep for Drive and in my current training role. So allow me to introduce to you our two main speakers today, Karen Lerner and Dan OMalley. So Karen, well, she's got a robust history working as an RN while focusing on wound care and rehab. She's been a member of the National Pressure Injury Advisory Panel Support Surface Initiative and has over 30 years of experience educating industry professionals just like yourselves and clinicians around the country. Prior to coming to Drive, Karen was VP of Clinical Services at a Northeast-based DME. Dan, well, he's got over 20 years experience in home care and long-term care settings while specializing in support services for the prevention and treatment of pressure injuries. Now, Dan is the man when it comes to teaching home care providers how to implement successful support service programs. Now that we've introduced our two speakers, we can cover the objective. Our objective for the audience over the next 30 minutes or so is to improve your ability and enthusiasm to identify, pursue, and be successful with Group 2 support service opportunities during and after this unfamiliar COVID-19 pandemic. How are we going to accomplish that objective? Well, we're going to stick to this agenda. Excuse me. We'll start off by reviewing some perceptions and challenges associated with Group 2 support services. Next up, we'll present some seriously favorable industry changes that will help us all to answer the question, why now? To make sure no one is comfortable with the status quo, we'll discuss some staggering statistics surrounding pressure injuries and their costs on our healthcare system. And finally, after we've convinced you why now is the time for Group 2s, you'll need a dependable partner. So we'll answer the question, why partner with Drive when it comes to Group 2 support services. Now, I promised all of you an engaging experience with today's webinar. So at this point, I will hand it off to our first speaker, Karen Lerner, to introduce our first poll to the audience. Karen, are you there?
I am, and thank you, Eddie. And hello, everyone. So, as Eddie said, this webinar is about identifying and pursuing a successful Group 2 support service business, but there are challenges, and we'd like your opinion, please, on which of these challenges pertain to you. Now, Dan and I have worked in the field with your local Drive reps and with many of you, and we've listed a lot of the challenges we've either encountered or we've heard about from you. So thank you. I'm going to wait a few more seconds, right? And I am now going to broadcast the results. Okay. So, my goodness, it looks like we do have a lot of objections and drawbacks to overcome over the next 30 minutes. Dan, are there any poll responses that surprise you?
You know, not really, Karen. You know, these are all common objections that I've heard in the past, so not surprising to see a mix of responses. The good news is we will address these concerns in this presentation.
All right, thank you, Dan. So, you know, we hear you. There are a lot of problems. There can be just getting the order. And once you get the order, sometimes you can't fill it or you're afraid to process it. Maybe because the medical records are incomplete, they're unclear, or they're filled with seemingly incomprehensible clinical or medical jargon. Those of you who are challenged by obtaining continued need documentation may feel it's not even worth issuing a Group 2 because you're just going to have to pick it up the next month, and maybe you think the product costs too much to make this worthwhile. Several of you checked getting and passing audits and getting too many service calls as challenges or hindrances to actively pursuing Group 2 support service business. We get it. It may simply seem not worth it or too challenging, and the entire endeavor can leave you and make you feel confused, afraid, maybe even angry. So that begs the question, what's different now? Well, there's a confluence of happenings right now causing an increase not only in the incidence and prevalence of pressure injuries, but also in the awareness of pressure injuries and the harm that they cause. In fact, about a month ago, our National Pressure Injury Advisory Panel, or NPIAP, issued a warning reminding healthcare professionals that just because we're in a pandemic doesn't mean we can ignore or undertreat the biggest organ in our body, our skin. This NPIAP issued statement warned there's been an increase in pressure injuries due to COVID's compromising not only our patients, but our healthcare system. And just last week, the NPIAP issued a position paper, again emphasizing the importance of many things regarding pressure injuries and highlighting the need for support surfaces. And they specifically pointed out two beneficial features only available in Group 2 support surfaces: low air loss and offloading alternating pressure. Every 5 years, our National Pressure Injury Advisory Panel issues new pressure injury prevention and treatment guidelines, and the latest were published late in 2019. Among the new guidelines is an emphasis on the importance of support surfaces as vital to preventing and treating pressure injuries. Remember, we know what causes them. They're not called mystery injuries. Pressure is the primary cause of pressure injuries, and the newest NP-IAP guidelines reminds us the only way to offload pressure is with support surfaces. The opportunity to prevent and treat pressure injuries with Group 2 support surfaces is huge, and you, our DME providers, are desperately needed. You can and should certainly court your typical and common DME referrals like local physicians and the case managers at your local hospitals, wound healing clinics, subacute or short-term rehab. But please also recognize there are a myriad of other channels in need of your assistance and guidance when ordering and procuring Group 2 support surfaces. Home health agencies began a new payment model this past January and are financially incentivized to care for and improve the lives of sicker patients, specifically patients with pressure injuries. Likewise, your local long-term care and skilled nursing facilities also underwent a new payment model, which began in October of 2019. They too are taking on higher acuity patients, seeing more pressure injuries, and literally may not stay in business without properly offloading patients with wounds. They need more and patient-centered Group 2 support surfaces. Why not get these from you? Hospices enhance the quality of end of life through comfort care. Nothing is more comfortable than a bed of air, and Group 2 support surfaces can help a hospice better survive in their own very competitive world. We may think Group 2s are only for Medicare and hospice beneficiaries, but there's an opportunity to market Group 2 support surfaces in retail too. Think about the difference between a consumer-grade mattress or overlay and a Group 2 support surface mattress replacement or overlay, which are so offloading, even a wound down to bone can heal. How big and important is this opportunity? I want you to please think about this. Group 2 support surfaces are not just for pressure injuries. When I started my clinical practice over 30 years ago, Medicare and most other payers covered Group 2 support surfaces for things like enhancing quality of life, improving sleep, reducing pain, helping to prevent atelectasis and pneumonias, to help reduce the turning and repositioning schedule so loved ones and caregivers could get some rest, and even to reduce falls. Once Medicare changed the rules, clinicians and DME providers stopped ever recommending Group 2 support surfaces for anything other than full-thickness pressure injuries. I don't know about you, but I know if I'm diagnosed with some horrid disease or I get a pressure injury, I'd want my treating clinicians and my DME provider to recommend whatever they thought was best for me. Not to say, hey, wait a minute, Karen, I see you have ABC insurance. Here's what I suggest. To further emphasize why now is the perfect time for pursuing Group 2 support surfaces, think about Centers for Medicare and Medicaid Services, or CMS, and our industry right now. Because of COVID, policymakers are viewing DME in a fresh and positive light, making significant accommodations to ensure as many patients as possible can be treated at home. In fact, CMS is placing a lot of trust on our industry right now. Prior auth is suspended. You don't have to do it. You can if you want to, but it's voluntary. Face-to-face is also suspended, except for power mobility devices because that's statutory. Even audits are currently suspended. And don't forget, because all competitive bidding awards expired the end of 2018, and the new bid program doesn't begin until 2021, any willing provider can currently bill Medicare beneficiaries for Group 2 support surfaces. These and other CMS efforts to put patients over paperwork has removed many of the fear-inducing and time-consuming barriers and challenges to Medicare beneficiaries who need Group 2 support surfaces. As DME providers, you currently have the flexibility to waive a lot of red tape, making it easier to issue and successfully bill Group 2 support services. Another change that is not COVID new that you may, however, not be aware of, or why ICD-10s make qualifying patients for Group 2 support services really not so hard. When I started in healthcare, there were ICD-9s, and in the ICD-9 list, there were a total of 9 diagnosis codes related to pressure ulcers. And the ICD-9 diagnosis codes did not include either a specific body location or a wound stage. In 2015, when ICD-10s were first issued, there were now over 150 pressure ulcer diagnosis codes. And yes, ICD-10s call them pressure ulcers, not pressure injuries. Because ICD-10s are tweaked yearly, there are now over 160 pressure ulcer diagnosis codes. But this increase did not make things more confusing or challenging. It made things much more straightforward and much more clear. L89 codes indicate pressure ulcers. And the next 3 numbers in that diagnosis code specify the body location and pressure ulcer stage, which are 2 of the most common requirements needed to properly qualify patients for Group 2 support services. Look, please, at the examples in the upper right of this slide. If you get a patient with an L89.113 among their diagnoses, they, in nearly all cases, qualify for and would certainly benefit from a Group 2 support service. Now, please look at the example ICD-10s on the lower right. ICD-10s make it equally clear which patients do not qualify for a Group 2 support service. L89.52, for example, references a lower extremity pressure ulcer. And since only wounds on the trunk or pelvis count for Group 2 support service qualifications, a patient with only this L89 code would not qualify under traditional Medicare for a Group 2 support service. When the wound is not caused by pressure, there is no L89, and therefore no qualifying diagnosis for a Group 2 support service. Now, I just shared a lot of information with you. If you have a question, please use the chat box, and I'll do my best to answer you. In the meantime, Dan, is there anything you want to add?
No, Karen, I think you hit the nail on the head. The L89 codes definitely make things easier. I would say best practices for providers would be to just look for the low-hanging fruit. What I mean by that is a patient that has a stage 3, stage 4, or an unstageable pressure injury anywhere on the trunk or pelvis. I mean, there are additional ways to qualify a patient, but that's the easiest and the most straightforward. In Drive, we have a complete list of the L89 qualifying codes. Obviously, that's way too lengthy to put on the screen today, but I would recommend reaching out to your local Drive rep to obtain the list.
Good idea, Dan. Okay, I don't see any questions, so I'm going to go on. If questions come up, I'll do my best to answer. But thanks, Dan. That were good comments. So listen, in case you need more convincing that Group 2 support services are a worthwhile pursuit and worth chasing, especially now, perhaps wondering if the work involved or the squeeze is worth the results or the outcomes or the juice, I'm going to give you some examples of why, when it comes to Group 2 support services, the juice is most definitely worth the squeeze. So let's compare a few local coverage determination requirements, or LCDs. A lot of you probably chase CPAP business. It takes far less time and energy to accept an issue and even ask for continued qualifying Group 2 support service documentation than it takes to get 90-day PAP compliance. A lot of you bill for semi-electric hospital beds. And most hospital bed prescribers think if the head of the bed needs elevation, the patient's going to qualify for that semi-electric bed. It takes a lot of education to get clinicians to include the semi-electric hospital bed LCD requirement of immediate or frequent need for position change in the medical record. That takes a lot of work, a lot less work to simply ask those prescribers to include all 89 diagnoses codes in their referrals to you. How many times have you had a callback or referral to remind them you can't issue the wheelchair they just ordered until somewhere in the medical record it says a cane and walker have been ruled out to perform those MRADLs. People who treat pressure injuries must include a wound's width and length and stage for their own reimbursement. It's way easier to get these Group 2 support surface related notes than asking for manual wheelchair qualifying documentation. In other words, the juice or Group 2 support surface business is worth the squeeze for education for you, your staff, and referrals. Now I want to have a little bit of fun. Look at these celebrities and please tell me which one died from a pressure injury. I wonder if there's anyone on this call who's as old as me and remembers Casey Kasem's American Top 40. My husband and I still listen to him on Sirius XM 70s channel. I'm going to further date myself by telling you the first president I was eligible to vote for was Ronald Reagan. You know, I saw Christopher Reeve on Broadway before he became famous, and much later I saw him in rehab at Kessler Institute here in New Jersey. Hey, Dan, are you an Elvis Presley fan?
Absolutely, Karen. Who doesn't love the king?
All right, with that, I'm going to broadcast the results. All right. I'm actually not surprised that most of you knew Christopher Reeve of Superman fame did indeed die from sepsis or infection of his full thickness pressure injury. But maybe you didn't know that both Casey Kasem and President Ronald Reagan died with a pressure injury, but not because of a pressure injury. And poor Elvis, he died from a heart attack. You know what? Thank you all for participating and for paying attention. Warning, my next slide, I am going to show you a couple of actual photos of stage 4 pressure injury. So if you're at all squeamish, you might want to close your eyes. So look, this is what they look like. And I don't mean to shock you with these graphic and very real photos, but I do want you to realize there are a lot of people besides celebrities who suffer from painful, debilitating pressure injuries. And if our industry continues to be a reluctant or fearful Group 2 support surface provider, pressure injuries are going to increase. Let me share some truly staggering statistics with you. Hospital-acquired conditions, or HACs, are medical errors that should never occur. In fact, they used to be called never events. And they are tracked in long-term care and skilled nursing facilities, home health agencies, and virtually every other healthcare institution, not just hospitals. As a country and healthcare industry, all the monitored hospital-acquired conditions have decreased. We've shown improvement, except for one category, pressure injuries, which have increased 6% despite the regulatory oversight. And in America, we're still killing 60,000 Americans every year due to the pressure injury. That is not dying with a pressure injury. It means the cause of death was a pressure injury like Christopher Reeve, who succumbed at age 52. We haven't called pressure injuries bed sores in a long time because it's well known that wheelchair users are at very high risk for pressure injuries. 34% of wheelchair users develop a pressure injury within their first year using that wheelchair. You know, one of the reasons I became an assistive technology professional, or ATP, was to help prevent and treat pressure injuries in my own seated dependent clients and patients. So it's my very strong and very considered belief that 100% of wheelchair users should be evaluated for a bed support surface. And very frequently, that surface should be a Group 2 support surface. The yearly number of pressure injuries in America is 2.5 million. And that only includes full thickness or stage 3 and stage 4 pressure injuries. Remember, as per our National Pressure Injury Advisory Panel, the only way to prevent and treat pressure injuries is to remove the cause, which is pressure. And unless someone figures out how to levitate patients, the only way to redistribute pressure is with support surfaces. Did you know America has 70% of the world's attorneys and boy, do we like to sue. 17,000 pressure injury lawsuits every year occur in this country. The average settlement, $250,000. The final statistic I'll share with you is the waste of money we spend on treating pressure injuries. Nearly $27 billion per year is wasted on these largely preventable happenstances. I hope you now agree with Dan and me that this opportunity is huge. And I also hope you can appreciate how you and our industry can make a big and positive impact on pressure injury, saving both lives and dollars. Dan is equally passionate about helping to save lives with Group 2 support surfaces. But as a guy with over 2 decades experience successfully selling support surfaces, he's going to share with you more staggering statistics, these having more to do with the business end of things. Dan, please take it away.
Thank you, Karen. So I wanted to start by saying you don't have to be a rocket scientist to be good at supplying Group 2 support surfaces. I mean, take a look at me. I'm Dan OMalley, and if you read our bios for this webinar, I absolutely have none of those initials that Karen has in her title, nor have I ever worked for a home care provider. However, I've been working the last 20 plus years, as Karen mentioned, on the manufacturing side of the business, teaching providers how to successfully run Group 2 support surface programs, and I'm excited to share some information with you today. One stat.
Hey, Dan, this is Eddie. I hate to interrupt as you're just getting into your flow here, but we've got a question in the chat pod from Scott Wood.
Okay.
He's experiencing some denials when he's not sending in prior authorization. I know he asked the rest of the audience if anybody else is having this problem, not getting any responses, but part of having you available as you see customers nationwide. Could you add some thoughts here on Scott's situation?
That is interesting because Karen mentioned prior authorization has been suspended. I know it's kind of a new program, but I personally have not heard of anyone getting denied for that reason, but obviously it sounds like it happened to Scott. So I would be curious if anybody else can type in the chat window if that has happened to anybody else, or is this just a one-off, thing that maybe somebody was not informed on the other
Dan, you know what? I'm going to comment as well. Listen, a line that I've been saying for a while is, never equate logic, and common sense with Medicare. So the prior auth program, 100%, I can send you the proof source, is suspended. So it means somebody who's processing claims didn't get the memo. It's suspended. And I will, Scott, look up your email and send you the proof source, and maybe you can include it in your denial. That's my only comment. So.
No, that's a good question, and it's interesting. So let me continue with, again, one stat I found that was very interesting and quite disturbing, honestly, was in a review done just a couple of years ago by one of the DME Macs. It showed over a 60% denial rate for Group 2 support services. I mean, this is a staggering number. The top reasons for denial were either the patient didn't qualify or insufficient documentation. I mean, these are both fixable, and it's all about education. So Karen, do you think the fears of qualifications and documentation are reasons holding providers back from this extremely profitable segment of their business?
Well, based on our first poll and what you just brought up, it sounds like it probably is, but it shouldn't be. Before coming to Drive, I worked in the provider side for over a decade, and I had more than my share of Group 2 audits. Among the things I learned to do to make sure I'd pass every audit, and I did, was get really good at reading the medical record to make sure the patient qualified before I'd issue the Group 2. It was little things like knowing Medicare wants the pressure injury to be at least 8 centimeters measured by width by length, and that unstageable pressure injuries are always full-thickness wounds, and therefore patients with unstageable pressure injuries do qualify for a Group 2 support surface. It was knowing how to read the medical record and knowing when to ask for additional documentation that helped me pass every Group 2 support surface audit, and therefore enthusiastically go out of the business. So, Dan, let me throw it back at you and ask, do you need to be a clinician to read the medical records and understand if a patient qualifies for the Group 2 support surface?
Absolutely not. I've been reading medical records for over 20 years, and it's pretty clear to me who qualifies for a Group 2 and who doesn't. If I can do it, anyone on this call can do it. And as we already established, I'm the one with no initials after my name. So we're going to pivot for a second and bring up the results of a question we asked each participant during the pre-registration for this webinar. We asked you what your most profitable DME category was of your business. And here are the results. It looks like sleep and respiratory are the winners, followed by manual wheelchairs. Karen, anything jump out at you with these results?
Well, yeah, the first thing that I find interesting is that all these categories, I guess except for sleep, are for patients who are immobile or partially immobile, which means they either have or they're at risk for pressure injuries, and they could benefit from a Group 2 support surface. But I'm actually really surprised that so few folks chose I don't know, because in DME, profitability is really hard to figure out sometimes. As a provider, it took me a long time to realize that Group 2 support surfaces were by far my most profitable business category. I mean, I was able to recoup my acquisition cost after just a few months of running, and I simply don't know of any other capped rental where that's the case.
Thank you, Karen. I see we have another question in the chat pod by Amy Ramsey. Can you provide info where the guidelines that mentions unstageable is covered? Karen, do you want to handle that?
Yes. So there was, when the ICD-10s were first issued, they weren't, and it was immediately recognized by the NPIAP that because unstageables are always full thickness or stage 3, they 4, they should be covered. And again, I cannot recall whether it's written into the LCD. I actually think it is, but it's definitely in the list of qualifying diagnoses. So in the LCD, there is a list of the qualifying L89s for Group 2s, and unstageables are now listed there. It's an updated list, but it's there. So again, Amy, I'm going to have Eddie keep track of this. I will find your email on the registration, and I promise to send you that proof source as well. But look at the most recent LCD. You'll see it written there.
Excellent. Thank you, Karen. A couple things there I wanted to mention was make sure it's still on the trunk of the pelvis, and you think the 8 square centimeter, rules should apply here just to be safe?
Oh, well, that's going down another
we'll move
sort
on.
of another road, right? The LCD says large, and this has been debated for at least the 30 years that I've been involved in. Medicare, Noridian, or CGS will not define large. I just know from a lot of experience, the 8 centimeter rule is what they're looking for, and absolutely I would include that for unstageable. So good point, Dan.
All right, thank you.
And I see Amy wants the information as well, so I will send you a proof source as well, Amy Mullins. Thank you. Okay, Dan,
Absolutely.
sorry for interrupting. Yep.
Not a problem. So now that we're on the subject of profitability, let's take a look at the profitability after costs of some commonly ordered and issued cap rental DME items using average competitive bid rates. So the semi-electric hospital bed package, billing code E0260, if successfully billed for the full 13 months, would yield the provider approximately $300 in profit. The standard manual wheelchair, billing code K1, would yield approximately $150 profit over the same period of time. Now, a Group 2 support surface with the billing code E0277, for example, would yield the provider approximately a $1,500 profit on a cap rental. However, more than likely, the patient on the Group 2 support surface will not cap out, which is actually great news for the provider, enabling them an even better ROI on their purchase. The margins on Group 2 support surfaces are some of the highest in our industry. Looks to me like the Group 2 juice is definitely worth the squeeze. One more thing I would like to share while we're still talking about profitability is it's not just a Group 2 support surface. It's important to note that any patient that is in need of a Group 2 support surface would most likely qualify for and benefit from many additional DME products. Now, although a patient doesn't need a hospital bed to qualify for either a Group 1 or a Group 2 support surface, more than likely the patient will require a hospital bed. That same patient, due to their limited mobility, may require a mobility-assisted device. The patient's respiratory system may also be compromised, resulting in the need for either oxygen or other respiratory equipment. And last, any patient with a painful pressure injury, transferring can be difficult and they could benefit from some type of transfer device. Now, these are just some examples of additional DME items that the patient may also need along with their Group 2 support service. So again, it's really not just a Group 2 referral. It's really an entryway to supply the patient with a suite of products that can truly enhance their quality of life. Group 2 support services can be some of the most profitable referrals a provider could receive. Now, if status quo continues and providers fail to embrace a successful Group 2 support service program, more and more patients will not get the support service they need. Healthcare costs will continue to rise and more patients will die. Providers will miss out on large revenue opportunities. And audit denial rates will continue to scare providers away from pursuing this profitable segment of their business. Now, as many of you heard before, doing the same thing over and over and expecting different results is the definition of insanity. Well, it's time to stop the Group 2 insanity. Now, let's take a look at what these results have and will continue to look like if we don't embrace a successful Group 2 program. Now, there is an increasing cost of not pursuing the profitable Group 2 support service business. Providers that have refused to change make up a majority of the 34%, which is 1 out of every 3 home care providers that lost their business since 2010. This staggering statistic came from AA Home Care in 2018 when they released their supplier number analysis. And this trend is increasing across other industries, with the Wall Street Journal finding 100,000 brick and mortar retailers also shutting down due to COVID. We learned this on the first Drive Cares webinar on retail, and we can't stress enough how tired we are of these statistics and want to see our providers grow instead of shut down. Now, this industry is filled with people that care and set out to do what's best for their patients, but sometimes I feel this is forgotten and we fall into complacency. If we're not going to look out for our patients, who will? The patients and their families will. And e-commerce will continue to use popular items like Group 2s to expand their reach and steal what business should be yours. The bottom line from all these stats is, don't let your patients or your company become a statistic. Okay, it's time for another poll question. So I want you to imagine for a second that you and your business embraced Group 2s and implemented a successful Group 2 support service program. What types of impacts would this have on you, your business, and your community? Please check all that you think would apply. Possible answers we got. Yep.
For introducing the poll here, maybe as the audience is participating in this, you can address Amy Mullen's question here in the chat pad about her beds being delivered with Group 2 support surface mattress, just making sure she wants to ensure she's billing that appropriately. I'm guessing you need additional information.
I'm trying to find the question. Could you provide the guidelines on stageable? Our beds are delivered with Group 2 support surface mattress, which is included in the bundle of the bed. Should we be billing differently? So is she saying, Amy, I think if I hear you correctly, you're billing one code that includes the bed with the Group 2 support surface? Because I know normally you would be separating those out. And is this Medicare or is this a different payer?
Dan, I'm going to chime in. So the way, while Amy's given you more information, Amy, I suspect that maybe you're confusing Group 1 support surfaces with a Group 2 support surface. The most common bed code is E0260, semi-electric bed. That includes the bed frame, a mattress, and side rails. And very often the mattress in those bed codes is a Group 1 support surface. It would be very rare and very costly if you're actually doing a Group 2 support surfaces and including it in the bed bundled code. So a stand matter, it's not a Group 2, somebody else said. So is your mattress, yeah, if you tell me the name of the mattress, it's still highly unusual. Sometimes that's done for hospice patients, but then nobody's billing Group 1 or Group 2 support surfaces. You're You're just billing the hospice. So while that's going on, the chat, yes, Fair Mattress is a group 2. So Amy, again, offline, if we can't, you should absolutely bill for the group 2 as long as they qualify, without question. Yep. And you would change, for instance, that billing code to an EO261 if it's your group 2 is a mattress replacement. So as I say, there's a lot to this. So if we don't get to it, we'll certainly address all your questions offline. Okay.
Yeah,
sorry,
Dan.
Dan.
I'd like to follow up with Amy. So I'm going to go ahead and broadcast the results. I don't think you could go wrong there because every single answer would bring positive results to your business. And the results are, let's see, increased revenue, better clinical outcomes, and new referral relationships. Excellent. Karen, any thoughts on this poll?
Yeah, I'm glad that increasing up-caring opportunities got a fair amount of love there, because I think that sort of that collateral business that you're going to get when you embrace Group 2 support services is one of the most impactful outcomes. In my own experience, once particularly home health agencies and wound healing clinics, but even case managers from hospitals and insurance companies trusted me to give their patients the right Group 2 support service. They trusted me to handle all their need-intensive patients, and it was like they said yes to whatever DME I recommended. So I'm glad people recognize that that's a big part of why Group 2s are so valuable.
That's a great point, Karen. So again, we wanted to say thank you to everyone for staying engaged. We appreciate the interactivity. So hopefully we have you leaning in, thinking to yourself that pursuing more Group 2 support service orders is worthwhile. And you may be thinking to yourself, well, how do I get started? Here we go. So how do you get started? Well, it's easy if you have free access to knowledgeable clinical and industry experts who can help train your staff and referrals on all aspects of a Group 2 support service program. This includes both in-person training and remote training. Educating both your staff and referrals will help you avoid some of the pitfalls we saw in the denial rates seen in the MAX review. Offering clinical CEUs to referral clinicians is a great way to help brand yourself as providing these clinically effective products. And marketing materials and handouts can be an easy and effective way to help educate everyone involved. For home care providers looking to increase their Group 2 market share in their area, it's all about knowing your ABCs. A is initial qualifications. Know the 3 ways to qualify a patient, and remember, large unstageable wounds are now covered. Also, remember in that DME MAC review we discussed earlier, one of the top reasons for denial was that the patient didn't qualify. B is continued documentation requirements. Not only what notes you will need on a regular basis, but knowing where to find them. And C is product knowledge and selection. Your staff must be knowledgeable of the products so they can safely advise patients and caregivers how to use them. In addition, knowing what Group 2 options exist can allow the provider to match the appropriate Group 2 product that best meets the patient's needs. Now, if you're thinking you don't have the staff or the manpower to tackle a Group 2 support service program, let us hold your hand. Or, in today's environment and more appropriately, let us give you an air elbow bump from 6 feet away, wearing gloves, a gown, mask, face shield, and some goggles just to be safe. The point is, we are here to help, and we have the expertise to make sure your company pursues the Group 2 support service market the right way and avoids the traps we discussed earlier in this presentation. And Drive has your back, and we have you covered. This map shows the location of our national sales support team, which include local territory business managers, actual boots on the ground, regional sales directors, regional vice presidents, and clinical vice presidents like Karen and myself that specialize in Group 2 support services. All Drive resources are available for teaching, training, and coaching both your staff and your referrals. I'm now going to send it back to Karen, who I think has another poll question for you. Karen?
Yep, thanks, Dan. And I am going to answer Renee's question, who's saying don't you have to try a group 1 for 30 days prior to a group 2? So that's a common misconception. So you're right, it does say it in the LCD, but only when the reason the patient is getting the group 2 support surfaces is for multiple stage 2 pressure injuries on the trunk and pelvis. When it's a stage 3, stage 4, or unstageable, that's large, or at least 8 centimeters by width by length, I always say immediately pass go, you get your $200. In other words, you do not need to be on a group 1 for 30 days prior. Similarly, if you're post-op flap or graft surgery, you don't need to be on a group 1 30 days prior. So that's only when the indication is for multiple stage 2s. So, Dan, anything you want to add to that?
No, again, one of the ways we said, just knowing the 3 ways to qualify. That is one way to qualify if they have the multiple stage 2s, but like you're saying, Karen, there are other ways, like the Monopoly game, where you pass go, get 200, and go straight to the group 2. So that was a great point.
Exactly. Okay, so another poll question. So we've been revealing to you how and why group 2 support surfaces are worth chasing, and we shared some of the tools and resources available. Now we'd like your input, please, on how you'd like us to assist you. Whether it's one-on-one support with your local rep or the things you see here. And good, I'm glad you're choosing a variety, and if there's anything we've forgotten, use the chat box. And whatever you choose, and you can certainly choose them all or ask for something we didn't include as a poll choice, we're here for you. Your Drive local reps, Dan and I, and we're free. It's our pleasure to work with you. I am going to broadcast the results. All right. A lot there. And remember, between Dan and me, we've been doing this for over 50 years. So there's no way we could teach or share it all with you in this, less than 1 hour seminar. So please do reach out. Drive to Vilbis Healthcare pays Dan and I to work for you. So put us to work, please. And again, I'm glad you checked a variety. Dan, is there anything you want to add?
Karen, I would have just said, regardless of anyone's specific answer or answers to this question, Drive can help, whether it's training their staff, customer service, billers, sales marketers, or their referrals on the basic qualifications and documentation requirements for Group 2s. I mean, we've done this countless number of times with many customers, and it can be a lot easier than you think. That's all I wanted to add.
I think those are great points. Thanks. So again, I thank you for participating. You've been wonderful. And let me advance. Okay. Remember, Drive sells literally thousands of wonderful, durable medical equipment and various products, but pressure, and especially Group 2 support surfaces, are a niche kind of concierge division within Drive. We're really devoted to it, and we're proud of our suite of products and our ability to match the product to nearly every patient and any provider. And we know our Group 2 support surfaces perform beautifully in a variety of healthcare and home care settings. Our Group 2 support surfaces have been tested in the factory and under real-life patients with real-life pressure injuries. I've personally used Drive Group 2 support surfaces to help heal a lot of nasty, tough wounds, and I can vouch for their ease of use and their clinical effectiveness. Drive Group 2 support surfaces really are effective. They're reliable, they're robust, and they're intuitive to use. And as Dan taught us, they have an undeniably strong return on investment or ROI. We can give you safety and clinical specifications and show you and your customers pressure mappings and things like moisture vapor transmission rates, and discuss our immersion and development and performance tests. In fact, we can dazzle you with all kinds of data. And if you'd like, we look forward to doing that. At the end of this presentation, Eddie's going to show you how to contact your local Drive rep, in case you somehow don't know who he or she is. And that's what I want you to do, is contact your rep. So before I pass it over to Dan for a recap, I just want to say thank you for participating and attending. And I do look forward to working with many of you in the very near future. Dan, please wrap things up for us.
Thank you, Karen. We did cover a lot of information today, so like Karen said, let's do a recap. We discussed the perceptions and challenges with issuing Group 2 support services. There are a lot of challenges, and billing Group 2 support services isn't easy, but it is simple if you have a process and the right resources. We reviewed why now is the time to get on the Group 2 bandwagon. Increased demand, less rules and regulations. There's never been a better time to pursue this profitable segment of your business. We shared compelling data of our industry's current state of the union and why something needs to change. And we conveyed why Drive is the best partner to help you pursue this opportunity. I would also like to say thank you for everyone for joining. We truly appreciate your time. Enjoy the 4th. I'm now going to hand it back to Eddie to finish out the webinar. Eddie?
Excellent. Thank you, Karen. Thank you, Dan. Outstanding job. You both certainly inspired me to know that now is the time for embracing Group 2s, and Drive is going to be the best partner to help you do that. So just a couple things to mention in closing. Drive truly appreciates the support of our audience and customers, and we really thank you for attending today's webinar, especially on a shortened holiday week, as many of us are having Friday off. So thank you, thank you, thank you. Now, we want to hear from you with any thoughts or concerns regarding this webinar. And in case you need any help identifying your Drive rep, the Drive Customer Solutions number is right there, 877-224-0946. They'll certainly be happy to assist you in identifying your Drive, local Drive support. We also have one remaining scheduled Drive Cares webinar coming up after the 4th, so on July 8th. Please join us to help ease all of those respiratory concerns coming out of what we all hope, again, is the end of this COVID-19 pandemic. We did get asked if there will be a recording sent out. We'll certainly send that recording to Paula. For everybody else, down in the right-hand corner, there is a PDF download in that file pod. So if you want to quickly do that before I conclude the webinar, you can download the slides in PDF fashion. And we'll certainly follow up with those that chatted in the box that require follow-up, along with Paula, to get that recording there. So with that, we thank everybody for attending. You're going to automatically be taken to a short SurveyMonkey survey to help us maximize the value of these types of webinars in the future. So please take a moment to complete that. With that, take care, everyone. Stay well. Enjoy your afternoons, and everybody enjoy the 4th of July holiday. Take care, everybody.